Hello there. Welcome, welcome, welcome. I'm Dr. Perkins, a board-certified OBGYN. Today we're talking about PMOS or PMOS, what every woman with PCOS should know right now. If you have PCOS, you may have seen this already, but as of May 2026, PCOS has a new title, PMOS. I'm not sure if we'll say PMOS or PMOS, but PMOS is Polyendocrine Metabolic Ovarian Syndrome. While this is a label change, there's a lot of information that I think is important for you to start considering now that may impact your treatment and your plan when it comes to PCOS. In this video, we will talk about why we went about this name change and, more importantly, what you should do about this information now. PCOS. We've talked so much, especially on this channel, about PCOS. I love PCOS personally and professionally, primarily because I've had my bouts with it myself, but it is really a core of prevention that is almost like the reason for my professional life, because through prevention, I believe that we can be better beings, we can live better lives, we can be much happier, much before we experience a problem that now requires a treatment and cure. While I live holistically and I try to encourage others to do the same, PCOS is one of those conditions that may truly be changed or improved based on your lifestyle. So considering all these things, I've dedicated a lot of my time to PCOS, and so I'm truly excited about this change. The Lancet published this information in May 2026. While PCOS and those with PCOS will remain with PCOS, the title will now change and our approach will be changing a little bit as well. 22,000 patients were studied and led to this 11-year process to get this name change. True reason why we needed this change is because PCOS previously meant polycystic ovarian syndrome. I've had so many conversations with patients about what that actually means. By terminology, you would assume that it means that you have cysts on your ovaries, and that is not the case. In fact, quite a bit of patients with PCOS had completely normal ovaries, and maybe they ovulated regularly, but they still displayed and experienced symptoms having to do with metabolic issues, hormonal issues, and these weren't really being addressed appropriately because there was a little bit of a hyper focus at times on the ovaries and how they looked, and that is actually not the case. So now, polyendocrine metabolic ovarian syndrome really encompasses the true nature of the condition, and I think with this, it will allow us to diagnose this condition more often, but more importantly, treat it with a better approach than we have been. Now, what does not change right now? If you're already diagnosed, you'll remain with the same diagnosis. Your treatment plan probably won't change drastically. You'll continue for several years to see PCOS on insurance forms. The conversations in the office will still likely be surrounding the same terminology. The diagnosis may also remain as this gets rolled out over the years. Oftentimes in medicine, I usually say that it takes us about 5 to 10 years after there's been a medical change before this becomes well integrated in society, in our medical practice. It takes a while before guidelines will change and improve. And so expect that this will be the same situation with this condition. Now, polyendocrine really covers a lot of different things that you may experience. We know about insulin and insulin resistance, and this will still be the core of what PMOS is about. There will be a greater focus on other endocrine changes like androgens, focusing on their impact on PMOS. We will look more closely on how these hormones influence each other, and we won't focus on one hormone independently as much as we have in the past. When we think of metabolic in the term as well, this will encompass much more than it has before. We will look at things that link to long-term risk problems, such as impaired glucose tolerance, gestational diabetes, dyslipidemia, meaning that we have lipid issues like triglycerides and cholesterol issues. There will be much more look on hypertension and the impact of that. And we will absolutely focus more on cardiovascular disease, because we know that with PCOS and PMOS, that the heart and our vascular system is highly impacted by the hormonal imbalance that comes with this condition. At this time, we think that PCOS affects about 1 in 8 people worldwide. We really truly think, however, that about 70% of people are undiagnosed. I can sometimes tell if someone has PCOS without lab results and without imaging. And most of these people that I can say, this person has PCOS, these patients are often completely unaware. They've probably, and sometimes more often, have never heard of the term before. This means that there are so many people experiencing it without appropriate treatment, not with the education that they need to make a change in their life, their lifestyle, their habits, and their practices. And so this change overall will hopefully be able to capture those patients, provide help to them while improving our treatment approaches as well as our diagnostic abilities. While we were working on releasing this new name change, a lot of studies were done, and most clinicians and patients who knew that they had this diagnosis, most said that they are excited about this name change because of all the stigma that was related to the PCOS term before. I think that this is really exciting times for the medical community, for the PCOS community, and the new PMOS community. And I'm excited about what the future advancements will look like. Stay tuned for all the additional videos and information that will follow this video, and really celebrate the fact that we are moving in the right direction, and hopefully we'll be able to help many others. As I mentioned before, PCOS, now PMOS, is by far a hormonal imbalance situation. And so if you've been on this journey for a while, I have a ton of videos that talks about PCOS. They will still apply even though the name change has occurred. Please take a look at them. I actually linked one below in this video today, because I think that it will help to lay the appropriate foundation as we continue to build on what we know about PMOS and its future. Thank you so much for listening in. Thank you for celebrating this change with me today. I look forward to seeing you in a future video. Thanks for listening, and take care.